How much short-term damage has the EU done to its citizens by falling so far behind other countries in the West in COVID vaccinations? How much long-term damage has it inflicted upon itself, facing accusations of incompetence and petulance in handling its response? This is Roundtable. Hello and welcome from me, David Foster. As a bloc, we are stronger is an EU mantra. But in this case, it's looked cumbersome and its reputation for togetherness appears to have suffered. The EU Commission was put in charge of buying vaccines for 27 nations. It did manage to get lower prices, but there's been criticism of delays and bureaucracy. At the centre of the crisis is a dispute with the vaccine maker AstraZeneca. The company was supposed to deliver 80 million doses to the EU in the first quarter of this year. AstraZeneca says it only promised to make what it called best efforts to fulfill the order. The EU says a binding contract was signed and called on supplies to be diverted from the UK. Last week, the EU announced controls on vaccine exports. And because the controls included the UK, a key part of the Brexit divorce deal was under threat. The open border between British territory in Northern Ireland and EU territory in the Irish Republic. The European Union was forced to backtrack and make clear that the border will stay open. With disputes going on over demand and supply, how damaging could this episode be for the European Union? Well, I'm very pleased to say that we can welcome to this round table out of Brussels Kathleen Depoorter, member of the Federal Parliament in Belgium. We travelled to Oxford in the UK, and there we see Alberto Giubilini, Senior Research Fellow at Oxford Uehiro Centre for Practical Ethics, and then to Geneva in Switzerland. Gwen Eamer joins us from there. She's from the International Federation of the Red Cross and Red Crescent. Gwen and Alberto, I'll ask you about your moral sense of where this is happening in just a moment. But Kathleen, let me come to you first of all. From a Belgian perspective, did the European Union mess up?
Well, I think they did make some mistakes, of course. They went through the very bureaucratic way of handling, which is typical for the European Commission. So that means that we did waste a lot of time. And if we compare to Britain, then we're 3 months. They are 3 months ahead. And that's a bit pity because our patients are also waiting for the vaccine, of course. The vaccines are made, or some of the vaccines are made in Belgium. So it is quite frustrating to see that other countries are going ahead and we're waiting. We're also arguing with the pharmaceutical industry. It should have been done nicer and preciser. That's what I think.
Okay, so where did it get it wrong? Was it just bureaucracy? Was it bullheaded? Was it too stubborn? Where did it make its mistakes?
Well, I think mostly it is the bureaucracy, but it's also the fact that they've invested a lot in the research and development of the vaccines, such as did UK and US, but they took a bit for granted that they would get the vaccines into the European states. I think in the handling the contracts. They were a bit naive. And then there's, on the other side, the producers who were a bit overconfident and who promised a lot. So you can't really blame one or another party. But if I look at from the inside, and I'm also a pharmacist, so I'm really, I'm really concerned for the health of the patients, then I think that they should have done their best a bit.
And has it damaged the reputation of the European Union as a negotiating bloc, as something that can presumably say that in the past it was able to deliver more efficiently because of its numbers? Has it taken a knock for that?
Well, you can't say it's a real success. So I think it did they did take a knock. If we compare it with Israel, if we compare it with Britain, then we can't say that we're the best of the class. They were really, really proud of their contract, but I think that at the moment they can't be proud anymore.
Okay, Gwen, let me ask you, the European Union threatened to ban exports. We've got the case with the UK, Northern Ireland and AstraZeneca, but generally, are we seeing countries putting their own interests first?
I think in general, we've seen an enormous amount of, what's being talked about as vaccine nationalism. And I think we need to really step back and say, both on a question of humanitarian ethics in terms of what is right morally and ethically, but also even if we look and take a broader picture of our own self-interest, we need to recognize that equity and making sure that the most vulnerable people in all contexts, whether they share a postal code or a passport with me or not, if we don't vaccinate all of these people, we need to recognize that, there will be continued high levels of transmission. Every time that you transmit the virus, there's an opportunity for mutations. And we've seen very clearly in the past few months the emergence of these variants of the virus that currently there's testing going on and certainly evaluation going on right now in terms of how effective the current vaccines are against those variants. But we know going forward, transmission and high levels of transmission create opportunities for mutations. They create opportunities for the emergence of variants. And at some point, it may be that those variants are not effectively combated by the vaccines that we have available to us. So if we go all in,
we're all worried about that. We just don't know at the moment. But when it comes to vaccine nationalism, you cannot vaccinate everybody all at once. So therefore, does it not make sense to protect your own population first? You've been on aeroplanes where they say, in the event of a cabin depressurization, the oxygen mask will come down. Put your own on first before you help anybody else.
Sure, and I think a number of countries certainly are prioritizing the most vulnerable people, which I think is really important. But we need to be looking at the most vulnerable people globally, not just people inside our own borders, because we have to recognize the importance, both in terms of equity, that this is the right thing to do, that people who are immune compromised, who are elders in our communities, who are frontline workers and doing the hard work of keeping these folks alive when they do fall sick, that they all deserve the same level of access to vaccination. And on the purely sort of Machiavellian side, the more that this virus transmits in whichever community, whether it's my country, your country, or a third country, there will be mutations, and those mutations have the possibility to create variants that come back to haunt us. That if we achieve the highest level of vaccination in our own countries, all of that work can be undone by not investing in vaccination in other places.
Let's hear, before I come to you, Alberto, from Ursula von der Leyen, European Commission President, who's been having a difficult 10 days.
Europe invested billions to help develop the world's first COVID-19 vaccines, to create a truly global common good. And now the companies must deliver. They must honor their obligations. And this is why we will set up a vaccine export transparency mechanism. Europe is determined to contribute to this global common good, but it also means business.
So it seems to me, Alberto, coming to you, that she seems to be wriggling a little bit, trying to make excuses for what went wrong as far as the outside world is concerned. What do you see?
Well, I think Europe has a big responsibility of this situation. Not so much for the deal, the technicalities about the deal between pharmaceutical company and the European Union, but as was said before, for the delay in approving the vaccine. So Europe is a few months behind the UK, behind Israel, it's behind the US. Now, the problem is that delay, in this case, costs life. Every day you wait before approving a vaccine or rolling out a vaccination program, that means that more lives will be lost. So I think the EU should take responsibility for that. I don't think it has managed the pandemic very well so far in terms of vaccination strategy, but I think at this point, so this is the situation. No, I don't think there is much point in now digging back and asking whose fault this is. I think the question now here is, what should we do now? So we have a situation where some countries, like the UK, has a large availability of the vaccine, has doses for more than, so in the next few weeks or months, we will have more doses than vulnerable people needing it. So there is a question about whether this doses that would otherwise go to young people, so less vulnerable people in the UK, should instead be given to other countries like Europe, for example. But it's not just Europe, so
but why?
around the
But
world.
just help me with this, because I don't fall into the category of young people, but I don't fall into the category of either vulnerable or extremely elderly. I'm still waiting for mine. Wouldn't I be right in thinking, hang on, I need it before somebody in Hungary, perhaps?
Yeah, so I said that there is the question. I didn't say that the answer is yes, let's give all the vaccines to other countries. So that's the question. And it's a question about vaccine nationalism. So I think it makes sense and it's ethically justified for each country, each government to look after their own first, because countries have special responsibility towards their own taxpayers. That's what we do with any, so we're talking about vaccines, but any other kind of resource is the same thing. So countries have special responsibilities toward their own citizens, their own. So it doesn't mean that they have a responsibility only towards their own citizens, but it means that there is some ethical justification to giving priority to your own country, your citizens, your taxpayers. So UK government put a lot of money, a lot of millions of pounds into the Oxford vaccine, for example, as did Europe, every country. But once a country invests money, then it needs to justify its policies to its own taxpayers first, its own citizens first.
Yeah.
On the other hand,
so let's. Oh yeah, carry on.
No, on the other hand, it is right that you don't get out of a pandemic nationally. You only get out of a pandemic globally. And there is another thing that the pandemic is now managed with this very tight restriction. So we are in a lockdown. So lockdown is harming young generation most, because young generation have less to benefit from lockdowns because they're not at high risk from COVID-19. So we owe to young generations in the UK. So the government, among these special responsibilities, has to make sure that lives go back to normal. But this cannot happen locally. Again, we need the global community to go back to normal.
Well, it is a very, very difficult balancing act.
Yeah,
isn't it?
that's
You're
another
never
reason
going to keep everybody happy. So, Kathleen, let me ask you this from a Belgian perspective. How is the country looking outward in terms of getting vaccinations to other people through perhaps the COVAX scheme or indeed other ways? And how is it looking after its own citizens?
I think Belgium is investing in COVAX, of course. We want this solidarity. But I also agree with Alberto when he talks about caring for your citizens. We're politicians, we've been elected to care for our community, for our politicians. So I think that this group immunity in Europe and in Belgium, we really need to reach for it. And he was talking about the youngsters, but I do know that the mental health in Belgium of young people is really suffering. So it's not only the vaccine, the vaccination, but it's getting back to normal life. And of course, we should really work together that most of the people of the world can get vaccinated in a very short time. That's why we have the COVAX vaccine. And if we have an overhead of vaccines, then we should deliver them to other countries. But it's not only the COVAX, it's also the organization. If I look how difficult it is here in Belgium, in a developed country, to organize the vaccination, to have enough refrigerators, syringes, healthcare workers, then I'm sure that it will be very difficult in other countries too. So if we want to help, then we have to give the whole package, and we have to be sure that, for example, the Pfizer or the Moderna vaccine, which have to be stored at minus 70 degrees or minus 20 degrees.
This is something I wanted to ask about, because the Oxford AstraZeneca one can be produced at very low costs, partly because it's easy to store. Some of the other ones, the Pfizer one, as you say, have to be kept way, way below freezing, and they cost a great deal more money. The UK has said it will provide any extra doses of the Oxford AstraZeneca vaccine at cost. What about the more expensive vaccines? Are other countries saying, hang on, we're going to charge you that extra, or what is the deal?
As far as I know, the patent will be delivered to the funds of Bill Gates and Melinda Gates, and then there will be a deal. But I'm not really sure of the details of that. But of course, if for example, Belgium has invested €4 million in the COVAX, then we just pay what's needed. I don't think that Belgium should decide whether the vaccine will be delivered at cost or not, because there's quite a difference in the development of the AstraZeneca vaccine. There's been invested a lot of money, public money from our citizens. So this is also why AstraZeneca says it will just be for the midst of the crisis. It's not a long-term investment. When we talk about BioNTech, Pfizer, and Moderna, then it is a long-term view that they have, because they want to develop more vaccines. So I think for us as a Belgian government, the most important is that we might help people in other countries, that we show our solidarity, and that's where it ends.
Dr. Ghebreyesus, I'm asking this one to you, Gwen. Head of the World Health Organization says something morally reprehensible is happening here. Is that the way you see it?
To me, we have a really fundamental human need to focus on the most vulnerable people, regardless of their passports or where they slept last night. And I think we need to be talking both about equity between countries and also equity within countries. Even if you look at the countries that have begun rolling out large-scale vaccination, we see enormous disparities in who is accessing those vaccines. Certainly, most countries are targeting the highest risk people, the most vulnerable people medically in terms of age brackets, also frontline workers and healthcare workers who are more likely to be exposed while delivering essential health services. But I'll take the example of the United States, and this is not at all to single out the US, and in fact to commend them for collecting data that's disaggregated by things like age and sex and gender and race. But we see things like Americans being vaccinated, white Americans being vaccinated at 2 to 3 times the rate of their Black counterparts. That's a problem. And when we need to be, one, collecting the data to be able to understand who are we missing systematically. Are we rolling out systems that people have access to? Do they have the information that they need to be able to access these essential services? Are there systems barriers? Are there cultural barriers? Are there social and economic barriers to actually getting these essential services? And I think we need to be looking at that across countries. So between countries, and certainly COVAX is an important mechanism for that, but also within countries.
I'll come back to you, Gwen, if I may, and ask you about the global campaign that the Red Cross and Red Crescent is launching, or has perhaps just already launched. But I want to come to you, Alberto, and ask you about the situation in countries that make the headlines for the wrong reasons: Syria, Yemen. What are the dangers if the vulnerable people there aren't inoculated? Because it's very difficult to decide who is most vulnerable, isn't it?
Yes, so most countries go by an age ranking criterion. But so for these other countries, so there is a problem of equity and of making sure that the vaccine rollout is effective. But it's right that we need to make sure that these countries, for all the difficulties they have, for all the political reasons, do have enough vaccine supply, because as was said before, the pandemic will come back to us if we don't address the needs of these people. So we are not going to address the pandemic locally. The problem is that each country needs to do their fair bit. So the question is, what is fair for each country to do? So, for example, a country like the UK has vaccines for more than their vulnerable people. Should this country? So, what is fair for this country to give to these other nations?
Yeah, but who plays Solomon here? Who decides who deserves to get the jab?
Well, no one deserves the jab. That's not what deserve. Who decides? Well, the COVAX is a good platform by the WHO, and I think there should be strict criteria for how much each country owes to the global community in this term. So we need strong criteria, but the problem is how to figure out what these criteria are. So, for example, I give you an example. Here in the UK, we have these age groups. So one good compromise would be, so for a country like the UK to vaccinate the first 4 groups of vulnerable people. And then when it comes to vaccinating the younger people, those resources, both financial and the actual vaccines, should be probably distributed to other communities, so some of the countries you mentioned, or maybe the EU, to make sure that the uptake is as consistent as possible throughout the world. So if the UK does this, and if Europe does this as well once they have enough vaccines, if the US does that, then at some point we can address the problem globally. We are at the stage where we can't do that now because we don't have enough vaccines, and each country is looking after their own. But there might be a point after which the vulnerable in each country are protected, and we need to think about these other countries and these other vulnerable people in other countries, because otherwise the measure will come back, and otherwise we'll not go back to normality.
I suppose it depends how you measure vulnerability. If it is in terms of how seriously ill you get because you're elderly, that's one vulnerable group. But as has been mentioned before, the young are also an extremely vulnerable group who are suffering from mental health issues, among other things. That's just a point I'm throwing out there. Kathleen, what is the position within the European Union and perhaps within Belgium as well about making sure there is some kind of equitable share? I mean, actually, who does decide, as I said?
Who does decide? I think it are the politicians, together with the experts, who decide which group is vaccinated first. But what I would like to say is that scientifically, I'm not sure that it is the right way to go if we're just vaccinating a shorter or a fewer amount of people in one continent. I don't know. I have my doubts, because we should make sure that the virus doesn't have any hosts anymore. So this variant, we're all worried about it. But I think from a scientific point of view, that it would be a good idea to vaccinate all European first. And you can talk about vaccination nationalism.
All Europeans of all age groups?
Of all age groups, yes, because as I told you, I'm very concerned about mental health of the youngsters. I think people should get on moving in Europe. We can't move, we can't travel.
But isn't that,
economic is closed.
If it's not nationalistic, then that is continentalistic, for want of a better word.
But I'll explain why. Because if we travel and we travel within Europe, then if you can see it as a closed cocoon, let's say, and if you then head on to another continent, why not? I think we're talking here about less than a year, because if we look at it right now, then we know that producers will produce a lot of vaccines, and I think really we should move on. We should vaccinate as fast as possible, the whole world, and this solidarity is very important. But we should also make sure that our people, our citizens, are vaccinated, and that we can move on. Because if we want to make sure that our economic network is moving on, then we need to do the economics open. And if we want to stay strong and help other continents, then we also need this vaccination, because we're not moving ahead.
It's almost impossible to come up with some kind of answer. But your thoughts, Gwen, as you're hearing what Kathleen has been saying. Continentalism, look after our own, then we can look after other people.
I mean, I think as Red Cross, Red Crescent certainly will always be bringing the perspective that the most vulnerable people, regardless of their passports, regardless of where they wake up in the morning, deserve life and health. And I think for me, that's a very core fundamental principle. And I don't think anyone here is disagreeing with that. It's a question of priorities and how we sort of view what our responsibilities in the world are. And certainly for Red Cross, Red Crescent, we will advocate as much as we can and as loudly as we can, and we will do everything that we can on the ground to make sure that the most vulnerable people everywhere are getting access. But I'd also like to bring up a point specific to this sort of dichotomy of we vaccinate everyone or we stay in lockdown. And I'd also like to really recognize that for countries that have done very well with COVID control, the vast majority of them have not achieved this exclusively through lockdown. And so there is also a middle ground of continuing to invest and scale up in traditional public health measures, really high quality risk communication with communities so that people understand, what's changing about the world, how do I get it.
I'm going to have to cut you short, Gwen, because I wanted to ask you about the global campaign. You've got about 45 seconds to tell us about that, the one being launched by the Red Crescent and the Red Cross.
Sure. Red Cross, Red Crescent is launching an initiative to vaccinate and support vaccination against COVID-19 around the world. And what we're doing primarily in this space is what we call the last mile. So reaching those most vulnerable people and getting vaccines from central distribution points into the arms of the most vulnerable people. That can be risk communication. It can be having volunteers in small communities physically going out and identifying the most vulnerable people, their elders in their communities. They know who they are. They have connections to them, and bringing them for vaccination. In some contexts where we have clinical capacity, where Red Cross and Red Crescent volunteers and staff are clinically trained, we can be providing vaccination directly to the most vulnerable people. And really, it's about making sure that these people, whether they be frontline workers, whether they be folks who are on the move, people who are in situations of detention and deprived of their freedom, to make sure that all of these people have equitable access to vaccination.
And I'm sure you have a great deal more to say, Gwen. I'm sorry, I'm going to have to cut you short. I think what each one of you has said illustrates that perhaps we haven't really started to control this yet. We're just beginning to understand how big a problem it could be. May I wish you all the very best of luck in whatever you're doing relating to this topic. Thank you for coming on the programme, and thank you for watching wherever you happen to be picking up this edition of Roundtable. From me, David Foster, from the team that made it possible, and from our guests, goodbye for now.